President Biden this afternoon, very publicly, again, showing the importance of protecting ourselves with vaccines, taking his Pfizer booster shot live on camera. He also, again, called out the damage caused by Americans who have yet to get even one shot. Because of them, we have fallen far behind globally. According to the New York Times, Portugal leads the world with 84% of its population fully vaccinated. Wow. The U.S. ranks 42nd with 55%. Dr. Jha tweeted this: even Vermont, our most vaccinated state with 69% fully vaccinated, would rank 15th in the world. In fact, 17 states still have not vaccinated even half of their residents. Let's bring into our conversation MSNBC medical contributor Dr. Vin Gupta, a pulmonologist and global health policy expert. Dr. Gupta, what do we do?
Nicole, good afternoon. I think it's important to recognize that Chile, a lot of these other countries that are high up on the list, Canada, the United Kingdom, they have universal healthcare coverage. And one of the key findings here, Nicole, for those that are unvaccinated is that they're uninsured. I've spoken to many of these uninsured individuals. They're young, they're scared. And yes, that means that they're vaccine hesitant. And I know we're all frustrated with the fact that those individuals exist. And yet if we do not bring them into a healthcare system that they feel estranged to, we're not going to get rid of this problem. Mandates are a short-term solution, so we have to bring them in. We have to make durable healthcare access possible for everybody, regardless if they're young or old. Number one. Number two, we have to make sure that they're engaged. Maybe that's office hours. That's providing education sessions that are mandated, not necessarily mandating the vaccine. But I've seen these work with my own two eyes, and I think that's where we have to head for medium-term and future-term success.
Let me show you something that that Pfizer's saying about the timeline for vaccines for children under 12 years old.
We were all given numerous COVID tests. I mean, so many. Sunny and Anna's Friday results turned out to be false positives, and everyone is safe, healthy, and COVID-free.
So that was The View. We can share with our viewers good news that they're all safe, some false positives. But I want to talk about vaccines in kids because I have some reporting from the White House I want to ask you about on the other side. This is Pfizer CEO on data for 5 to 11-year-olds.
I think we are going to submit this data pretty soon. It's a question of days, not weeks. If they approve it, we will be ready with our manufacturing to provide this new formulation of the vaccine, because the vaccine that the kids will receive, which is 5 to 11, it is a different formulation. It is almost it's 1/3 of the dose that we are giving to the rest of the population.
So, Dr. Gupta, it seems that the people most likely to vaccinate their kids between 5 and 11, and I could be proven wrong, but will be people who themselves as adults in the household are vaccinated. Do you worry that we're heading down a track of really becoming totally parallel? You know, we have vaccinated adults with their vaccinated children going to schools that happen to be in places with more mask mandates. And we have this other track where, for a variety of reasons, either being on the outside of healthcare system or hostage to disinformation or a political tribe, the parents aren't vaccinated. They don't seem likely to vaccinate their kids if they don't vaccinate themselves. Where does that lead us?
Well, Nicole, I certainly that's plausible, but there is going to be more of a pressure on school districts across the country to mandate the COVID-19 vaccine than there will be for employers necessarily, especially small-sized and medium-sized employers, to mandate the vaccine for their work staff. So I do think you could see a situation where, yes, parents may not assent to the vaccine because they don't have to, because their employer isn't large enough, or their employers decided to test the unvaccinated every week, for example, but that children in those same geographies are mandated to get the vaccine. I suspect that's going to be a reality in many instances. But yes, of course, we will see this parallel existence play out, and we have to be prepared for that.
Dr. Gupta, what do you think when you see Mitch McConnell and President Biden, who can't seem to agree on anything on the legislative agenda this week, both getting their boosters on the same day? Does that inspire some confidence that people will model that behavior?
Well, you know, I will say this. Mass communication is only so effective. It's great to see that bipartisan committee. We need more of it. What I will say in this goes back to the first point here, direct engagement. We need more of that to convince those that are unvaccinated to get vaccinated.